Social isolation is taking its toll on elderly people living in the Geelong region.
1 in 4 older people in Greater Geelong live alone. So that's a quarter of all older people who are 65 years and above.
The stark statistic emerged at a regional hearing for the inquiry into support for older Victorians from migrant and refugee backgrounds.
We know social isolation is a big risk factor for elder abuse.
Members of the Legislative Assembly Legal and Social Issues Committee travelled to the Bayside City to hear firsthand from service providers, community groups and advocates.
Another key priority that our Elder Abuse Prevention Network sees is the real lack of resources for elder abuse prevention. We as a network want to see some more resources that are culturally appropriate and in language for people to access.
With a population of more than 250,000, the fast-growing Geelong region is now home to more than 50 distinct cultural communities.
Geelong's a really multicultural city and we're really proud of what we do here.
In North Geelong, there's a specialist multicultural aged care facility which is unique to Australia.
It's been purpose-built to ensure that it encompasses all their different cultural aspects and, it'd be fantastic to see those rolled out across other parts of the country.
The local operator appealed to the committee for long-term investment in the sector,
highlighting issues around workforce and training for carers to come into the aged care system, the ability for us to be able to deliver programs over a longer period of time rather than just for 12-month funding.
Global conflicts put pressure on regional support services, and there's an expected influx of elderly refugees from Ukraine.
I'd also like to acknowledge that we've got some Afghan elderly people as well from their trauma, and it's important that we're ready to be able to assist them and get them socially connected.
Witnesses highlighted the unique challenges faced by culturally and linguistically diverse Victorians as they age and called for improved education and communication.
In order to shift societal attitudes to challenge ageism and age discrimination, we really need long-term funding in this area.
Understanding the system, how does it work from an ageing perspective, but also making the tough decisions and being supported at home.
Tapping into existing migrant cohorts identified as a potential solution to filling workforce gaps.
The committee should be looking at how we can capitalise on the bilingual workforce that is transient, whether they are refugees, whether they are international students.
Beyond Geelong, the committee held hearings at Coburg in Melbourne's inner north and Ballarat in regional Victoria.
It's really important that we hear those voices and what they think works well, what isn't working so well, so that can be incorporated into our report.
I hope that the politicians that we spoke to today got a good understanding of the issues that we're facing, especially around mental health for our ageing called community and for our new and emerging communities, as well as getting them established to be contributing members of our community.
The committee is due to report to Parliament by mid-2022.
We are doing some amazing things, but we've got a long way to go yet.
To read full hearing transcripts and for further inquiry information, go to the website.